Well, President Cyril Ramaphosa will address the nation at 8 p.m. tonight. He's expected to provide an update on the fight against COVID-19 and the rollout of the vaccination program. Ramaphosa says that the National Coronavirus Command Council is monitoring the coronavirus infection rate ahead of Easter, as the holiday could become a super spreader event. South Africans, meanwhile, are once again being urged not to lower their guard. This as the number of daily infections, less than 2,000 cases and 200 cases compared with between 15 to 20,000 infections in December, shows a decline. 1,447 new coronavirus cases have been reported in the past 24 hours, bringing the total number of reported infections to 1,512,225. At least 157 people are reported to have died from COVID-19 related illnesses, bringing South Africa's recorded fatalities to 49,941. All right, let's unpack this further. And to unpack what is likely to come out of the President's address, we are now joined via Zoom by Professor Mosa Moshabela, the Dean of the School of Nursing and Public Health at the University of KwaZulu-Natal. A very good afternoon to you, Prof. Thank you, as always, for availing yourself to SABC News.
Thank you. Good afternoon, Flo, and to your viewers. I'm
just taking a look at some of the reactions on social media to the fact that the President will be addressing us this evening at around 8 p.m. Many assuming that there will be a move to level 1. Don't know what that's based on, but what are your thoughts about what the President will be saying this evening?
Flo, I think that the President has to lower restrictions, and for various reasons. I think that when we went into the second wave and we eventually lifted our restrictions to alert level 3 with additional restrictions because of the new variant, we did not expect that we would have the sort of a recovery rate that we have had. And a lot of it it's credit to a lot of South Africans abiding by the regulations and the rules. And in many ways, of course, we've seen a lot of death in this second wave. And there's been a lot of pain, a lot of suffering over a festive period. So there is a need for reprieve, and the President needs to lower the restrictions further and in some ways allow the businesses to recover while we anticipate the third wave.
Yeah.
So I think that because of where the numbers are, people are actually saying that compared to previous sort of waves, at this point we would have been at alert level 1. So it does make sense for people to predict that. But remember that the President is cautious about the third wave. And so he may not necessarily want to rush, or the NCC may not necessarily want to rush to alert level 1.
I mean, I do understand what you're saying there in terms of, the President possibly lowering restrictions and also maybe businesses recovering. But, we are also heading into Easter, which no doubt will be, a super spreader in terms of people moving from province to province, seeing their families, going on holiday, all those things that we're used to during any holiday season. So I wonder if it would be, a wise move taking that into account, or is there an expectation that he may then lower the restrictions and then bring them up again? I mean, what are your thoughts?
Yeah, my thoughts is that the NCC and the President are in a very tight spot because there is a lot of pressure to get the economy to recover. So from a public health perspective, in fact, a lot of people would have said, let's stay on alert level 3 for longer until we are past the third wave. But it does not necessarily make sense when you have to weigh it against other competing interests, and there is a lot of interest. So in a sense, it makes a lot more sense, Flo, to lower the restrictions further and maybe go to alert level 2 so that we can allow for more gathering and businesses. Because also remember that it's election year. I've already seen in the news that a lot of political parties are asking for more social gatherings, and all of these things are going to become risk factors. I actually think that people may be a lot more responsible around Easter this time around, but I worry about all the other competing interests that could drive the the third wave as risk factors.
And while I have you with us here, I'd like to get your analysis or your thoughts on how the vaccination drive is going thus far. I mean, we know that it has started with healthcare workers, where your particular focus is on. What have you been assessing throughout as this vaccination drive has been happening? What are some of the criticisms, or perhaps anything good at this time that you'd like to say about that?
Yeah, Flo, I think that vaccination is going to be the most important thing that we have to look at this year. And I think it would be really disappointing if the president doesn't address it in some detail at this point, especially because, we have now been introduced to the vaccines. People are having personal experience of taking the vaccines. There's a lot more confidence in the vaccine. People are now able to report what they experience in terms of the minor adverse events that people were concerned about. And we can see that there is increasing demand, and the supply we have currently under the implementation study is good, but it's not enough. We need a lot more. And so we expect that, there needs to be approval of the Johnson & Johnson vaccine after the US FDA has approved it. And when they exchange their doses, we should actually be seeing government begin to spell out what the plan is to roll out the 9 million doses that they've spoken about.
Yeah.
South Africans, the general South Africans public is asking for when can they start getting the vaccine. We can see the focus on healthcare workers as part of the phase 1, but we need to start detailing the plan around how access is going to be achieved. It's actually the vaccines flow that are going to help us minimize risk in many ways in this country and be able to meet some of the demands of economy, elections, gatherings, and so forth. If we can get the vaccine rollout to happen, that would really bring us closer to where we would like to be as a nation.
Prof, always a pleasure speaking to you. Thank you very much for your input to the show.